I'm not striking out at you, but I know that when you go to work, you know that every week or every 2 weeks, you are going to bring home a certain paycheck. And if you didn't, you probably wouldn't keep that job. Right now, physicians are already dropping 25 to 40% of their patients because of high deductibles, okay? And these are people who are well-to-do, people who are making $100,000 or more who cannot pay their deductibles. So health care is already declining in this country. Now we're going to shift these deductibles on people who are impoverished. Yes, we're going to give them little handouts, okay? But they're still going to have an enormous deductible. And as physicians, you're supposed to take care of everyone, okay? That's your job. That's a Hippocratic oath. You have to help all these people who come in who are sick, who can't pay. But the physicians can't pay to keep their practices open any longer, okay? And I, for one, who run a practice and have a husband who's a physician and a son who's in medical school, I, for one, feel very strongly that somebody needs to stand up and stop the madness, because I think this is an enormous waste of time for our country. I think it's the demise of health care, okay? And I think people are spending a lot of time establishing these lovely entities that are not going to work, that are going to destroy health care, destroy it.
And as a physician, I appreciate everything you're saying, and I don't disagree with you. And we are going to have that other lecture on the Affordable Care Act, and it would be another good point and place for you to come and make your comments. But I think we need to address the issue the way it is now, because today we really can't make those changes, so we have to deal with what we have at the moment.
But
so
what we have is a room
right,
of physicians
and
who
we
don't
do,
have,
but
don't know
we
what
don't
they're
have our
signing up
politicians here, and we don't have other ways of dealing with this at the moment. So I think we should just address what we came to address today. So if we have any more questions on the exchange, yes.
Jason, repeat the question.
Yep. Actually, before that, I just want to make sure I respond to the comments. I don't necessarily disagree with anything that was said. This is a absurdly complex problem, and really, as the exchange, we are simply looking to implement the portion of the law which was passed several years ago. Is it a perfect law? Of course it's not a perfect law. I think it's rare that we'd ever see something like that happen. Two, we are providing access to insurance, and quite frankly, that's all we're doing. And whenever you increase access to a certain product, you may actually spur additional problems which need to be solved. And so, I'll go back to the last line on the slide that we had, which is, this is the beginning of a process. And I think you put it best, which is, it takes a host of folks. It's everybody in this room and the voice of yourselves. It's individuals in the political sphere. It's individuals in the business sphere who need to continue this dialogue. And it's not always cordial, it's not always pretty, it's oftentimes very difficult and uncomfortable, but if we don't have that dialogue, we were never going to improve the system. So I applaud you for speaking your mind, and I certainly encourage everybody here to stay very active in this dialogue. It's going to keep going, and it might actually get worse before it gets better. So stay active. We don't have to be shy about raising these issues, so thank you for that point. The question raised in the back was around, do we have any indication of the number of physicians who are currently participating in these plans? The answer is no, because the plans actually don't exist right now. So these are brand new plans that are going to be, they're sort of designed already through that